Genuineness. Identify the traits of a genuine counselor. Skills. Demonstrating acceptance, active listening and engaging the patient, reflecting on verbal and emotional content, appropriate questioning, allowing silences, and providing affirmations. Briefly summarizing the patient's problems, asking for feedback, and providing reassurance and hope. Demonstrating acceptance. This is a key skill for developing an effective counseling relationship. Acceptance can help patients express their thoughts freely. It helps patients with self-acceptance and self-esteem. Listening skills. Patients must know we are listening to what they have to say. Effective listening includes nonverbal and verbal behavior. Some of the nonverbal behaviors include appropriate eye contact, demonstration of attention, for example, nodding, leaning towards the patient, minimal distractions, for example, phone and other noise, avoiding doing other tasks during the session. Verbal behaviors include encouragement, for example, saying yes, aha, acknowledging the patient's feelings, not interrupting the patient unnecessarily, asking questions if something is unclear, not taking over and telling our own story, repeating the main points in the patient's words briefly. Reflecting. Reflecting means acting like a mirror. It involves stating the problem in the patient's own words and clarifying any unclear issues. Helps in checking out understanding of what the patient is saying and shows that we recognize its meaning for the patient. It also helps in underlying emotions associated with problems and thereby helps in achieving and communicating empathy. Questioning skills. It helps in understanding the patient's experience, assessing the nature of the problem, and working together. Open-ended questions are usually asked in the beginning, and it helps the patient talk and offer maximum information. Closed-ended questions usually are answered in few words, helps in focusing an interview and obtaining specific details. Allowing silences. It is a skill which should be used while listening. It gives the patient time to think about what to say and also the space to experience their feelings. It also gives the patient freedom to choose whether or not to continue and in proceeding at their own pace. It provides the counselor time to absorb the patient's words and provide an appropriate response. Providing affirmation. Affirmation is the expression of sincere appreciation of the patient's efforts and strengths in coping with their life challenges. This is an effective way of communicating a supportive and caring attitude. Affirmation strengthens the counseling relationship, and it helps in improving self-esteem. It encourages self-responsibility and gives the patient a feeling of being capable and in control. Summarizing and asking for feedback. Summarizing helps us to keep our focus on the important areas in counseling. It also helps in making transitions to relevant topics. An important part of summarizing is asking for feedback to assess whether we have understood the patient's problems accurately.